Hello and a very warm welcome, viewers. You're watching the brand new edition of India Fights Back with your host Kriti Mishra. Giving rise to fresh worries about the COVID-19 pandemic rearing its head again, the Rfactor, which indicates the speed at which the infection is spreading in the country, has risen recently, leading to a sluggish pace in the decline of active cases. Kerala and northeastern states have emerged as regions of concern. Rfactor has increased slightly to 0.88 in June end after being at its lowest ever value of 0.78 from mid-May till late last month. The decline in active cases has slowed down considerably in the last few days, and that is getting reflected in the estimation of our number as well. And for deeper insights on this, I'm joined by Dr. Sanjay Rai, Professor, Community Medicine, AIIMS, and Professor Sarman Singh, Director, AIIMS, Bhopal. Welcome to Sunset TV, both of you, and thank you so much for joining us. And Dr. Rai, coming to you first, what is this COVID's R number and why does it matter so much, sir?
See, this basic reproduction number, or we also call basic reproduction rate, it's one of the important tool of infectious disease epidemiology. So in infectious disease epidemiology, we use this tool to describe the transmissibility of an infectious agent, like in current scenario, transmissibility of your SARS coronavirus 2, transmissibility, or you can say contagiousness of that particular virus or bacteria. So in infectious disease epidemiology, use this term. We call this basic reproduction number, or also R naught. So henceforth, I will use this term R naught. R naught means I'm talking about basic reproduction number. So, and it's affected by numerous factors. Through modeling exercise, we estimate R naught for disease like SARS coronavirus 2, Imperial College London, almost at the beginning of the epidemic, based on few factors, and they gathered that information from that ship. What was the name of that ship? I forgot the name. The initial this outbreak was occurred in a ship near your Japan, Princess Diana ship, and so they gathered information from there and then estimated R naught somewhere between 1.5 to 2.5 that time. So this R naught, our basic reproduction number, is usually estimated with mainly three factors we consider in estimation of this R naught. The first one is what is the contact rate. Contact rate is the one basic parameter. The second one is duration of contagiousness after a person become infected. So usually this factor is constant for any virus or bacteria, this duration of contagiousness. But during estimation process, we consider this factor also. And the third one is likelihood of infection per contact between a susceptible person and susceptible persons, those who may get this infection, and an infectious person. So other than, there are other parameters also. Basically, we consider these three parameters, and all our actions are based on these parameters, like this lockdown, how lockdown help in reducing, and it's not R, but we call that effective R. So R. So then through this you call this lockdown contact rate, we reduce the contact rate, and that way effective R we are reducing. Same like wearing mask, etc. So how this through wearing mask, the second factor, likelihood of infection per contact between a person, infectious person, and also a susceptible person. So we can reduce that. So overall, this our goal is to keep or maintain this effective R below 1.
Okay.
So if R is less than 1, that means each existing infection will cause less than one infection and less than one new infection. In this case, the disease will decline and eventually die out. This is the natural course. But here, it's not this less than one is not because of your natural course. This currently, like you mentioned, 0.88
yes,
somewhere. So it's less than one, but it's not because of the natural infection or natural way. This is because of our measures, preventive measures like some lockdown or because of wearing masks, etc. So when we'll lose our guard, remove our guards, then this effective hour will increase and there will be the likelihood of some outbreaks. Same like, so our, if suppose if it's around one, then
yes,
what will happen? If
yes,
effective R is around one, then that disease will propagate in the community, but that will never happen a outbreak type. But if it's more than one, then likely to happen an outbreak. So this is the basic concept of R naught, or basic reproduction number.
Right, sir. That was a very lucid explanation that you gave, sir. But before I talk about its calculation, let me bring in Professor Sarman Singh as well. Sir, why are areas like northeastern states and Kerala, they're becoming a cause of concern as far as our number is concerned?
I will, carry on what Dr. Sanjay said, that, for the common people to understand better, because say, for example, this is simply that if 100 people are infected and how many they can further infect. So R naught is 1, then means they will infect another 100. Or if it is 0.88, as you mentioned, then 100 infected people, they can infect another 88 people. And if it is 0.78, then 78. So similarly, it is obviously in one, you cannot say that one person will, if it is less than one, means one infected person can infect. Obviously, the unit is 1, so they cannot infect less than 1. Obviously, so therefore, I am multiplying it with 100. But basically, if it is more than 1, then one person will infect another one. And if it is 2, then it will infect 2. So like in measles, it is 15. So one infected person can infect up to 50. So if it is less than 1, means one person will not be able to infect one person. But less than that means that if there are more than one person infected, then only one person will be infected. So in simple terms, for common people, our R naught must remain less than 1. But again, coming to your specific question, that few days back you did mention that there was the R naught in India, and particularly in these regions, Kerala and Northeast, was 0.78, and now it is increasing to 0.88. The region, basically, it has been, the central team went. I am sure that everybody knows it. So central team went, and then INSACOG did sequencing. And it is now evident that the new variant, Delta, is the region that it is new cases, they are coming up. And I am seeing on the, if you see the Ministry of Health and Family Welfare website, the number of discharged patients and number of infected patients is almost, it was more number earlier, those who were getting discharged from the disease, from the hospital, and the new infections were less. But now for last few days, as you very rightly said, that it is almost earlier, last 2-3 days, it was almost equal, and yesterday it was less. So means those who are getting cured and they are getting discharged, it is less than the new infections. So it means that the hospitals, they will have the more burden. So this is definitely a worrisome thing. And even though the R naught is less than 1, 0.88, but because you very rightly said, and this is indicative that it is going to be little worrisome, that from 0.78 to it has gone to 0.88. So definitely it is increasing, and it might further increase, and if increases to more than 1, then it may be a warning sign. So therefore, I think, as Dr. Sanjay also very nicely said, that there are various factors they contribute. One is lockdown, of course, but maybe in Northeast, the region being that probably they were a little complacent that in the first wave and even the second wave, they hardly had this, epidemic at a level which we North India and rest of the country saw. So probably their complacency was more. The Kerala model is very, very intriguing, and I'm sure that public health person Dr. Sanjay Roy and whole world is worrying about Kerala, because Kerala was the earlier projected in 2020 a best model of the world, and everybody praised like that. But now the same Kerala, it is not able to control the disease. This is the lingering the most. No state, it has never touched the peak. What definition? What we know as a medical persons, the peak, nobody knows then where was the peak and when this peak is going down. So this is Kerala is really a thing. Just before this show started, we were discussing that many of calculations, many of the models have been in this time, and the COVID epidemic has nullified. So I think there are some issues which are, because it is not a simple modeling. There are multiple factors they influence, including the mutations in the virus. Thank you.
Absolutely, sir. As you said, that it is a very complicated method of modeling, of calculating. Dr. Rai, as you're talking about these figures, these facts, tell us about the method of calculation. How do we calculate this number?
See, it's a very complicated modeling exercise. It's not a manual exercise, but it's a very complicated modeling exercise. As I mentioned earlier, that we consider these three basic parameters, but there are many other parameters also. So like in any modeling exercise, it's based on some assumptions. Assumptions about the behavior of the people, assumptions about the overall density, and then assumptions about the environment, if impact of environment on transmissibility, etc. So it's a completely a modeling exercise. And if like in any other model, if your input is good, your assumptions are good, then output will be definitely good. So here, just I want to add a few. You said about the Kerala and northern states. Yes, states. What happened? As Dr. Sarman Singh mentioned about Kerala, that initially we used to talk about Kerala, the Kerala model for at least for initial 6 months. And if you recall, the government of India implemented this lockdown on 25th of March 2020. That time there were around 600 cases in this country, and then but there was a gradual decline, gradual increase in the number of the cases. But except in Kerala, almost cases were stationary. The first case, although the first case on 30th of January reported from the Kerala, three students, they came from Wuhan city, and they reported, but February almost 0 cases all over country, and also in Kerala. But there were few cases in March and April in Kerala. But after April, if you see the graph of Kerala, that was a plateau, and they controlled this spread of this pandemic very effectively. Yes. But what happened after 6 months or 7 months, again, since last almost 5-6 months, Kerala is struggling, I can say, is struggling. And so why this is happening? Same thing you mentioned about the northeastern states. Even during the first peak, the peak appeared in northeastern states later. Again, it's the 3 basic parameters, and the second one was the likelihood of infection per contact between a susceptible person and an infectious person. So if you are reducing the pool of susceptible person, how can we reduce the pool of susceptible person? Our assumption was that for infection, we can reduce by 2 methods. One is through vaccination, and another one is through natural infection.
Yes.
This way, we can reduce the pool of susceptible population. But unfortunately, the vaccination is not reducing the pool of susceptible population for this infection. What vaccination is doing? Vaccination is reducing your severity and death. So this is a large benefit of huge benefit of vaccination. But to reducing the susceptible pool, it's not a very effective strategy, and this was our assumption. So now we are reducing this through only natural infection. Even after vaccination, people are getting infection, but the symptoms are mild, severity is very low, deaths are very rare in vaccinated group. So gradually, even the vaccinated group will get this infection. Soon a majority of us will get this infection, and then we'll move towards the herd immunity, and that is to reduce the susceptible population. And this happened in almost in all northern part of this country. Still, if you see all the zero survey, infection rates are much higher in northern part, and that's why this. If you see the Delhi graph, there was a sudden jump and there was a decline. But in Kerala, this is not happening, because overall, if you see the background infection rate, that was very low in Kerala. In all zero survey, that was very low. In Delhi and Mumbai, this rate was very high. And zero survey is the true representative of the actually community spread. Like in Delhi, last zero survey, before this second wave, 51% adults were infected. Same almost 50%, around somewhere between 14 to 50% in Mumbai. And that's why the wave went up very fast. And then because of this, your susceptible population pool, reduction in the susceptible population. But this is not happening in Kerala and Northeast. Definitely this will happen. Northeast, gradually they are getting infections. Currently in many northeastern states, the curve is either upgoing or there is a plateau. But very soon this will happen in Northeast. Kerala is a unique model. Kerala is infection rate is never was very high, and neither it's very low. Right. So that's why it's propagating at some pace, and we are unable to control this. Even if you see the vaccination, Kerala vaccination is one of the in all states. If you compare with other states, the maximum vaccination and the top 5 vaccinating states, Kerala is among them.
Yes, sir.
But we are unable to control. So this will happen gradually after this natural infection. We will reduce the susceptible pool, and then we'll achieve this. Thank you.
All right. So that was our experience as far as our own country is concerned. We were talking about Kerala. We were talking about northeastern states. But Professor Singh, what about the R number estimates in other regions and in other countries? What are the lessons for us?
The methodology and its use remains the same, whether it is India, because science never works, on the country basis. So science remains same across the country. So it is same, and people have used this R0, to control and manage most of the outbreaks, epidemics, and pandemics. So this is always used, and that is the reason that UK, you might have seen that UK is highly dependent on R0, and they on the basis of R0 they have decided when the lockdown should be imposed and when it should be lifted up. So most of the developed world and those believe in the science, they have been doing. So this is globally accepted and globally most practical. But only thing what we are talking that in most of the diseases are not, they have been most successful and the models. But except the COVID-19, this disease has, as we say that many of the assumptions we couldn't find that, what we assumed or what we proposed. All scientists, whether it is basic science, or it's pathology, it's immunology, or it's epidemiology, many of the things. So many of the new things, for the first time, this coronavirus behaved, totally differently, because it has most, if I can say, about 39 brothers and sisters, but none of the corona behaves like that. They behave differently, but this corona behaved totally differently. And, as I say, that all assumptions, what we thought that, again, one example is Kerala, another example is Brazil, Peru, and, some of the examples, they are there. Nobody thought of, and these are the things which probably we were struggling to understand, that pathology also, how this is, it is killing, the virus is killing the people, and then why thrombotic events are happening, what is the ground glass appearance, the brain, fogging, this kind of all things. So pathology, it has taught us. In fact, I always say, whenever I talk, we have, been much knowledgeable after this corona infection. So this has taught it has taught epidemiologists, our public health persons, our governments, our managers, our scientists, and everybody. It has taught a lot, and it has also shown that how weak our protocols, our assumptions, and the models can go sometimes, and we need to keep on upgrading all these models, including R0. So I think that is this virus has taught many of the things, but definitely as a standard, if you talk, minus coronavirus, the R0 is the standard textbook, well tested and well used. Most of the doctors and particularly the public health persons and those who work in the community, they have been dependent on this model, and this is very useful, and the whole world uses it.
Absolutely, sir. As you said, that this is an uncharted territory and we do not have structured protocol. Of course, the situation is very, very dynamic and we have to be updated and we have to be data-driven and evidence-driven. But time for closing comments from both my guests. First, you, Dr. Rai, keeping the R number below 1. Your closing comments, sir.
See, this is the overall objective of any infectious disease control program. So this is our objective, to have R0 less than 1. That is we call it effective or not R0. R0 is usually constant for that particular region or country because of this modeling exercise. So we call effective R. So our overall objective is to keep less than 1. This how can we keep with these various parameters, either with the COVID appropriate behavior or through natural infection already happened, or with the help of vaccination, a good vaccine. Currently, there are 18 vaccines, but they are not very effective against preventing infection. They all are effective against preventing your severity and death. So still we are in the search of a very good vaccine which can really impact on this effective R. Yeah. All
right, sir. Professor Singh, your closing comments?
Yeah, I would say definitely that R0 we need to keep down, and I always say that two multi-pronged, but definitely the two most important things are that vaccinate, and mass masking. These are the fundamental. Then only we can control, we can bring down the R0 down.
All right, so we have to be very, very vigilant. On that note, thank you so much for joining us, Professor Singh and Dr. Rai. Well, viewers, that's all we have for you in this edition of India Fights Back. But before that, let me remind you once again to wear your face mask, wash your hands and face regularly, and ensure that you maintain physical distancing whenever you're stepping outside. These simple precautions are all it takes to defeat this pandemic. Take very good care and goodbye.